Evaluating a case of tuberculous cold abscess. Cold abscess is due to caseation necrosis of tuberculous disease. It is commonly observed in case-eating tuberculous lymphadenitis, tuberculosis of spine, joint tuberculosis, tuberculosis of ribs, and mediastinum. Cold abscess may occur in the neck, mediastinum, thoracic wall, psoas region, or pelvis. The cold abscess slowly develops when tuberculous infection extends to adjacent ligaments and soft tissues. Risk factors. Socioeconomic factors, such as poverty, overcrowding, and illiteracy, as well as conditions including malnutrition, alcoholism, diabetes mellitus, HIV, and other immunosuppressive states, increase the risk. History. When you suspect a case of cold abscess, ask the patient for the history of chest pain. It is the commonest symptom in most lung diseases. It may be heaviness in the chest or pain in the shoulder and intercostal region in advanced disease. Previous history of tuberculosis, pneumonia, hospitalization, surgery are important. Note if the patient has a history of smoking. Look for the following symptoms. Fever, dyspnea, hemoptysis are seen generally. Cough is usually present. Note whether it is dry or with sputum, nature of sputum, productive or not, foul smelling or not. Loss of weight and appetite also occur. Swelling chest wall and discharging sinus formation may be present. General examination. Do a general assessment of anemia, clubbing, dyspnea, nutritional status of the patient. Physical examination of cold abscess. The characteristic clinical features of spinal tuberculosis include local pain, local tenderness, stiffness and spasm of the muscles, a cold abscess, gibbous, and a prominent spinal deformity. Cold abscess is characterized by lack of pain and other signs of inflammation. Formation of a cold abscess around the vertebral lesion is a characteristic feature of spinal tuberculosis. The site of cold abscess depends on the region of the vertebral column affected. In the cervical region, the pus accumulates behind prevertebral fascia to form a retropharyngeal abscess. The abscess may track down to the mediastinum to enter into the trachea, esophagus, or the pleural cavity. Retropharyngeal abscess can produce considerable pressure effects, such as dysphagia, respiratory distress, or hoarseness of voice. The cold abscesses, formed at lumbar vertebrae, most commonly present as swelling in the groin and thigh. Abscess can descend down beneath the inguinal ligament to appear on the medial aspect of the thigh. Pus collection can follow the blood vessels to form an abscess in gluteal region if it follows femoral or gluteal vessels, respectively. Investigations to be carried out include routine blood investigations, along with peripheral smear, blood culture, and C-reactive protein test, chest X-ray, and ultrasound. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.